Hello everyone, welcome to our Royal Metropolitan Student Council podcast channel. And we are going to cover one of the most interesting topic in modern science. And I am your host of second semester Yashwant from Royal Metropolitan University. And we have the guest, one of our beloved fellow mates, Miss Niharika.
Hello everyone, I am Niharika from second semester and thank you Yashwant for having me on your show today.
Thank you. So today we are diving into one of the most crucial and evolving topics in modern science, the advancements of cancer treatment and whether we are close to the cure. So cancer affects millions of people worldwide and approximately 20 million new cancer cases are found, and with around 9.7 million deaths worldwide. There are a lot of recent breakthroughs which are changing the way we think about its diagnosis, treatment and survival.
This is an exciting time in the cancer research and I am very glad that we get to discuss about that in detail.
So let's start with basics. When we use the term cancer, what exactly we are talking about?
That's a great place to start with. So the term cancer is a condition or a group of diseases which is marked by uncontrolled cell growth.
Okay. What causes uncontrolled cell growth?
See, normally cells, they grow, divide and eventually die, which is called apoptosis. This apoptosis is completely controlled or regulated by our body. But when it comes to the cancer cells, this control or this regulation is completely disrupted by the cancer cells. This causes the cancer cells to completely spread through our body, which reaches a stage called metastasis.
And that's what makes cancer so dangerous.
Exactly. It is very hard to cure cancer once it starts spreading all over our body. And also, there isn't just one type of cancer. There are nearly 200 types of cancers, each with their own unique characteristic.
Before we get into the new advancement, can you briefly explain the traditional treatments?
Of course, there are three main traditional treatments for cancer. First one is the surgery, where the cancer is being physically removed, and then we have chemotherapy, which uses drugs to kill the cancer cells, and then we have the radiation therapy, which uses radiation to kill these cancer cells.
But these treatments often have side effects.
Yes, especially chemotherapy, because it just doesn't affect the cancer cells, it also affects the normal healthy living tissues. And this is the main reason why patients often face things like hair loss, fatigue, and immune suppression.
So the challenge has always been precision.
Exactly. So let me ask you a question. How do you kill these cancer cells without affecting the normal healthy tissues?
Let me guess it. Immunotherapy?
Yes, it is.
I have heard it. One of the biggest breakthroughs we heard about is immunotherapy. What makes it so revolutionary?
Immunotherapy is truly a game changer. Instead of directly attacking the cancer cells, they work on the immune system to destroy these cells.
Why doesn't the immune system already do that?
Cancer cells are very clever. They hide from the immune system using checkpoint mechanisms which turn off the immune responses.
And immunotherapy blocks that.
Exactly. Drugs called checkpoint inhibitors, they remove these breaks and allow the immune system to work against the cancer cells.
What about CAR T therapy? It sounds so advanced.
It is. In CAR T cell therapy, we take the patient's immune cells, we genetically modify them and then reintroduce them into the patient's body.
That sounds so science fiction.
It does, but it is truly saving lives, especially in blood cancers like leukemia and lymphoma.
Let's talk about something very cutting-edge, gene editing, especially CRISPR-Cas9.
So CRISPR-Cas9 is one of the most powerful and most advanced technologies that we have in modern biology. It allows us to edit DNA with the best precision.
How is it being used in the cancer?
There are several approaches. One is where we can modify the immune system to make it more effective against the cancer cells, just like how we saw in the CAR T cell therapy. And the second one is where we can change the gene mutations, which may lead to cancer development.
Is it already being used in the patients?
It is still being used in clinical trials, but early results are promising.
Technology is also playing a crucial role, especially artificial intelligence.
Absolutely. AI is making a huge transformation in the cancer care in multiple ways.
Such as?
Such as AI can analyze medical images, they can also detect these tumor cells in a very early stage and also more accurately than the traditional methods which we saw before. It can also predict how a patient can respond to specific treatments.
So it helps doctor to make better decisions.
Exactly. It is definitely not replacing doctors, but it is one of the most powerful support tools.
What about cancer vaccines? Are those real?
Yes, they are, and they are very promising. For example, we have the HPV vaccines, which already prevent certain cancers.
So it's like immunotherapy.
Yes, exactly. They often work together.
So the big question is, Are we close to cure the cancer?
It is a complicated answer. Just like I told you before, cancer isn't just one disease but many diseases. But we are definitely making a very good progress. Cancer, which was once fatal, is now curable and even treatable.
So does the future look hopeful?
Very much so. The future of cancer treatment will involve a combination of AI driven care, precision medicine, immunotherapy, and gene editing.
That's incredibly encouraging, and thank you for making it such an easy way to understand the audience and for myself also.
Thank you, Yashwant, for having me on your show today.
Thank you.
Thank you. And thank you to the listeners who have been joining today. And if you find this helpful, make sure to share it and stay tuned for more discussions on medicine and science. And make sure to hit the subscribe button and the bell icon to get more updates. And don't forget to click the like button. This is your host Yashwant signing off. Until next time, stay informed and take care. Nandri and Vanakkam.